My name is Nakia Bolden. I'm a certified health education specialist, also known as a SHAS. My primary area of research is related to the HIV, human immunodeficiency virus, epidemic in the United States. The primary variables that I'm interested in are related to factors that influence engaging in high-risk behaviors associated with HIV. These behaviors include having unprotected sex, sharing needles or other injection equipment with someone who has HIV. This research is about the HIV epidemic in the United States. HIV is still a concern for many regions in the United States. Although progress has been made since discovering the virus in 1981, according to the U.S. Department of Health and Human Services, 2022. Approximately 1.2 million people in the United States have HIV. About 13% of them don't know it and need testing. In 2019, there were 36,801 new HIV diagnoses in the United States and dependent areas, according to the Centers for Disease Control and Prevention, 2022. There is estimated to be 1.2 million people in the United States living with HIV at the end of 2019. Of this number, only 87% knew they had HIV. 65% of new HIV diagnoses were from males who have sex with males contact. 23% of them were from heterosexual contact. And only 7% of them were from injection drug use, according to the Centers for Disease Control and Prevention, 2022. I will perform a 6-month study to measure the high-risk behaviors, lack of condom use, and adequate testing for high-risk groups associated with new HIV diagnosis. I want to explore if high-risk behaviors individuals are aware of their increased susceptibility, HIV status, and their education about proper condom usage. This study can help explain new HIV diagnosis and decrease and stop the spread of new HIV cases. This study can also help researchers learn barriers associated with testing and condom usage, or access to condoms. There is a lot of research surrounding HIV diagnosis in people who engage in high-risk behaviors, but there is little research on understanding why people engage in high-risk behaviors, self-confidence, and self-efficacy. Completing this research is beneficial to understanding why individuals engage in high-risk behaviors, self-confidence, and the relationship of HIV positivity rate. The purpose of this study is to examine the relationships between high-risk behaviors, self-confidence, self-efficacy, and HIV testing. Other demographic variables such as gender, injection drug use, job, sexuality, and testing frequency is included with these variables for a multivariate regression analysis with HIV status and recent testing as a dependent variable. There are research questions that's going to surround the study to figure out why these people engage in high-risk behaviors and how is self-confidence associated with condom usage and testing frequency. These questions are: is self-efficacy linked to HIV testing? Is high-risk behaviors associated with low self-efficacy? Is gender associated with HIV testing? Is sexuality linked to HIV testing? And what other factors influence HIV testing? For recruitment, I would create a recruitment survey via SurveyMonkey and post it on Indiana State University's Facebook and Instagram pages. Recruitment surveys will ask participants who engage in high-risk behaviors consent to participate in this research study. Recruitment survey will ask about needle use prior and current, men that have sex with men prior and current, high-risk behaviors such as prostitution, lack of condom usage, and multiple sexual partners. HIV status is known in recent HIV testing questions. Data will be organized and analyzed to compare confidence with the variables of likelihood of getting tested, condom use, sexual partners, and high-risk sexual behavior such as prostitution and men that have sex with men. Self-efficacy and gender will be measured as a variable of recent HIV testing. A factor that can enhance health education efforts would be programs aimed at improving proper condom usage. There is adolescents that do not have proper reproductive classes, with many individuals depending on porn sites for proper sex education. Another factor that can enhance the health promotion efforts are programs offering free condoms. Condoms can be expensive for many individuals, and providing free condoms removes the lack of access to care for condoms and reduces the costs and the list of purchasing them. The final factor that can enhance health promotion program is free and regular HIV testing. Educating the community on testing schedules and free testing ensures the participants complete routine HIV testing and reduce the costs associated with testing for those who may not have insurance or lack financial resources. This can also help reduce the spread of HIV for those that are not aware of their HIV status. A descriptive analysis will be used to describe the socio-demographics, high-risk behaviors, and self-efficacy among participants who had HIV testing in the past 3 months. Data will be analyzed using SPSS software. Researchers will look for a correlation of HIV testing using a multivariable regression and a t-test with number of sexual partners, condom usage using a Likert scale, high-risk behaviors, and self-efficacy using a Likert scale. Sexual orientation will also be compared to the likelihood of participants testing for HIV. It is theorized that participants with a greater self-efficacy will be more likely to have gotten tested with HIV recently. It is also theorized that participants who always use condoms will have a greater self-efficacy.